Hey everyone, today we're going to go through 4 of my favorite back stretches. I'm going to do it in a bit of a routine here. This is not exactly the speed you would do it, or I'd suggest you do it, but I'm going to speed it up for the video. If you want each stretch done in more detail, if you got any questions about anything, please hit me up in the comment section here. You can hit us on private message, go out of my way to try to help you out with it. Obviously, I don't know your individual situation, and without being able to assess people individually, see medical records, so on, it's difficult to be able to say whether this is exactly right for you or not. However, these are 4 very effective stretches. If done regularly, they can make a huge difference to reducing pain, increasing mobility. All right, so let's get into it. The 4 stretches, or the 4 muscles that we're going to actually aim at here, and I'm going to talk in broad terms, is the hip flexors, which run from the front of your spine. They're out of sight, out of mind at the front and down to the front of your hips. And their job is to essentially lift your leg, flex your hip. Okay, there's quite a lot of complexity in them, but we're just going to simplify it for today. Then, if we go the next layer back, it's a muscle deep in the side here. It's called your quadratus lumborum, or QL muscle. It's a bit of a sail shape. It goes from your lower rib cage down your spine and across the top of your ilium or hip bones. It is crucial. It's also an out of sight, out of mind, and people don't realize just how much discomfort it causes, let alone immobility over time. Okay, then the next one is this big, long erector spinae. We all know it. It's the one on either side of your spine at the back. It causes a lot of pain. It's a little bit more, it's treated more regularly due to its accessibility. But most people don't actually stretch it very well. So we're going to go through that. And the other one, most people would have heard of it, probably stretched it if you didn't know that you were stretching it, but it's called the piriformis. And it goes from your sacrum bone, this one in the middle of your back, and right across to your hip bone. It has a lot to do with the sciatic nerve. It has a lot to do with putting pressure on the sacrum. Okay, so if we stretch the hip flexors, if we stretch the QL muscle, if we stretch the erector spinae, and we stretch the piriformis, which by default will stretch most of your glute muscles, your glute minimus, medius, and maximus, you are going to go a long, long, long way to reducing your back pain, increasing mobility, and living a life that unfortunately most people don't because they don't do their stretches. So here we go. First one, hip flexors, starting in the front here. The hip flexor, historically, what most people have done is this big long lunge like this and then just done that. Nothing wrong with that at all, but we can do it better. The better way to do it, and lean up against the wall or a little bench or something, a chair, and you put your same leg that we're stretching, the left, you put your left arm up, then stretch to the ceiling, side bend, nice big arc through the body, and then drop into your hip. You'll notice my knee is not going over my front ankle. We're not doing this. We've got the foot right out in front and we're just dropping in like that, keeping my back and torso nice and straight. I'm keeping myself long, and I should feel that stretch through the side here and in the front of my hip. And there we go. Just that is the ultimate long position for the hip flexor muscle. And for those of you that want to know, it's also called the psoas, P-S-O-A-S. So they are the same muscle. One's just the common name, one's the Latin name. Now, that is the way to stretch the hip flexors. There is nothing that compares to that. Let's go on to the next one, QL. The easiest way to do this is down on your side. If you can't hold a nice square position like I am here, move yourself right up behind onto a wall, onto the front of a couch, and you can see here I'm locking away my hip and I'm bringing my rib cage and torso up away from the rest of my body, which is stretching this area here. If I want more of a stretch, I can go to here. Now, some people will find that's too much for them. If it is, and you need to be somewhere in between, what you can do is get a bolster or like a yoga block and basically leverage yourself somewhere in between so you can feel the stretch here. So for me, I can go to there, and in this position, you can play around with it a bit because I'm flexible enough that I can feel my ribs and my hip hit together on the other side here. So in order to reduce that, I can do this with my shoulder. and play around with the stretch and really try to bow myself, lengthen myself through my spine and my head. You know, you might hear in things like yoga where pulling your, sort of lifting the crown of your head or pulling through, lengthening through your spine. All those things are extremely good when we're doing these sort of stretches too. And just holding that really nice position there. And you can see I'm not rolling back, I'm not rolling forward. So it means I can concentrate the stretch right into the side of my body here. All right, and if you go into the stretch slowly, you come out slowly and roll over and do the other side. Now let's go to the next one. So we've done the hip flexors, we've done the QL, we're gonna do the big erector spinae. Now people would just think you bend forward to do the erector spinae. That has a very limited stretch. What we need to do, a bit like the hip flexor one, we need to put a side bend on the spine, then go into our stretch. So in this case, where I'm gonna do the left-hand side, my right hand grabs my left elbow over my head. It pulls right over to the left, over to the right. And from here, I'm staying right. And if anything, I'm going in this direction and I'm just bending from the hips. And as you can see now, not only am I getting a good forward bend, by staying sideways over to the right here, I'm putting maximum stretch through this area, right into the lower back and nearly the top of the backside. So right here, with all stretches, take big deep breaths in. And as you exhale, you will be bringing into force your parasympathetic nervous system, which is the part of the nervous system that actually creates relaxing. Okay, so as you exhale, lengthen into the stretch. Okay, slow deep breathing will help you get more range. Now, with this stretch, if you're over here, down here, and you've held it for quite a while, and you're thinking, gee, I don't know if I can come out of there without my back going, very simply, back to the middle, bend your knees, come up out of the stretch. Make sure you don't put too much pressure on your back. Okay, obviously do both sides. Next one, piriformis, glutes. We've all seen these ones, I think, done a million times. One version is what in yoga they call the figure of four. Foot goes on top of the knee. We have a nice four shape here. And then, if that's all you can do, put a nice push onto the knee and you should feel it back here in the hip and glute. If that's not enough, hands through, and you can use your arms and opposite leg to pull your foot towards you, which will accentuate the stretch down here. Okay, and then if I was to hold this same position and roll over, we get into this position here. And in yoga, this is called the pigeon stretch. This is probably the one that puts it under the most strain and you'll get the most out of. The whole idea is to keep your lower leg as square on as possible with your hips square. And then from here, you can do your deep breathing and sink into your stretch. Sink into your stretch, okay? And then swap sides. Okay, so it's a fast recap, and I can't really speed it up any more than that for the video, but that stretches the hip flexor, the QL, the erector spinae, and the glutes piriformis. If you do that regularly, it will do so much for taking pressure off your lumbar spine, your sacral spine, your pelvis. It is a remarkable group of stretches to help get you some brilliant results, and it's free, okay? Now, how long do you hold each stretch for? That will vary depending on the individual. For me, I use a bit of a yin yoga approach, and yin yoga is about holding stretches for 3, 4, 5 minutes in many cases, and it talks about being comfortable in the uncomfortable. Basically, I get people to work their way up. It could be a minute, it could be 2, 3, 4, 5, depending on where they're at and their flexibility levels and their pain levels, okay? But stretch when you're warm and ease your way in, ease your way out. And honestly, I'd rather 20 seconds done well than 5 minutes done poorly, okay? Technique is everything when it comes to stretching, when it comes to any exercise. Engaging in what you're actually trying to stretch is important. in clinic, I really spend a lot of time educating people so they can actually visualize the muscle that we're doing. I'm happy to do that on a more individual level for each one of those stretches in subsequent videos. But for today, let's just go super fast here. We're going to go down left side here, left leg back, left arm up, over, stretch in, and there we go. Beautiful stretch through your hip flexor. Okay, then we come up. And then I'm going to go down to the same one. We're going to go to the QL. From here, we get into this position. If you can get a really good stretch or you're quite flexible, come up to here, lengthen the body, and just play around with it until we get a nice stretch here. Come out of that one, standing up, left side. So I'm going to grab the left, my right arm, or right hand is going to grab the left elbow, over to the right, and then down to the right. Same thing, just tweaking it, playing with it until you can feel a beautiful stretch into your lower back here. If that gets, if you get a long way down and you're a bit concerned about coming out of it, back to the middle, drop the knees and up. And then when it comes to the piriformis, you had a few options from this here, or rolling right over and going into the more advanced pigeon stretch there. All right, hopefully that helps you out. Hit me up with any questions, any queries. Do my best. Obviously, people are all over the place these days. You can't often get into see someone like myself in our location in the world, but I'd love to help everyone out. So thank you for watching, and I hope there's something in there for you that can help you live a better life. All right,